Pathogenesis. Treponema pallidum infects endothelium of small blood vessels, causing endoarteritis. We'll be talking about that in detail in just a moment. Syphilis causes a spectrum of sexually transmitted diseases. There are two types of syphilis, as we've discussed earlier. Echoid is further classified into primary syphilis, secondary syphilis, and tertiary syphilis. Let's first talk about primary syphilis, that is early localized stage. This stage occurs 1 to 3 weeks after Treponema pallidum lands on skin or mucous membrane. These parakeets multiply at the site of inoculation, and local, non-tender, painless ulcer forms within 2 to 10 weeks. And this ulcer is called syphilitic chancre. If we talk about patients having the history of HIV, they'll have multiple chancres. When these parakeets destroy the tissue, they form syphilitic chancre. These chancres or ulcers have a hard base, raised borders, and they have fluid which is rich in spirochetes, which can spread to other body parts or other individuals. These ulcers heal spontaneously, but if they don't, and they spread to lymph, they'll cause lymphadenopathy, and if they spread to blood, they'll cause bacteremia. Primary syphilis can be memorized with painless because the chancres are painless. When the transfer occurred through sexual contact, primary chancre will be formed on external genitalia. And if the transmission was through physical touch or other way, the primary chancre will be formed in hands or other body parts. And blood for transfusions collected during early syphilis is also infectious. Now let's talk about the secondary syphilis, that is the disseminated stage. That occurs after the disappearance of the chancre, and lesions in that stage occur 3 months later. And this stage occurs after 6 to 12 weeks of infection. When spirochetes enter the blood, they cause spirochetemia, and they also cause generalized lymphadenopathy. The Treponema pallidum attaches to the walls of blood vessel, causes non-itchy maculopapular rash, which are small bumps, flat or raised. First they start on trunk, and then they spread to arms and palms, legs and soles, genitalia, and other mucous membranes. These lesions appear as maculopapular rash on palms and soles, moist papules on skin and mucous membranes. Rashes can be pustular, which are filled with white fluid, or papulous squamous, which are scaly and hard. And these lesions are full of spirochetes. Later, condylomata lata are formed. Condylomata lata are smooth, white, painless wart-like lesions on genitals, anal region, and armpits. These lesions are rich in spirochetes and are highly infectious, but they also heal spontaneously. Patchy alopecia also occurs. Constitutional symptoms like low-grade fever, malaise, anorexia, weight loss, headache, myalgias, and generalized lymphadenopathy also occurs in secondary syphilis. Secondary syphilis is the most infectious stage of all stages of syphilis. Rashes usually resolve within a few weeks to months. Certain systemic symptoms like pharyngitis, meningitis, nephritis, and hepatitis may occur. Now let's talk about the third stage or phase, that is latent phase. Disease enters its dormant or asymptomatic phase. If the primary and secondary syphilis are untreated, a latent phase may occur. Spirochetes and capillaries of organs and tissues are found. The latent period can be divided into early and late stages. An early latent period which can last for 1 or 2 years after the secondary stage. The symptoms of secondary syphilis can reappear and patients can infect others. And in this stage, these parakeets, the Treponema pallidum, are present in blood. In the late latent period, which can last for many years, no symptoms occur and patients are not infections. But in this stage, spirochetes are present in organs and tissues. Serologic testing will be positive. Few spirochetes are present in blood. Severe immune response will occur, and that will be the beginning of tertiary stage. Tertiary syphilis occurs months to years later after exposure. If there are few spirochetes in blood, there will be severe immune response, which will be led by T cells and macrophages. They will release certain cytokines like tumor necrosis factor alpha, interleukin-1, and interleukin-6. This immune response is called type 4 hypersensitivity reaction. And there will be certain symptoms like swelling, edema, redness, warmth, and fever. Plasma cells like to get involved in the process, so they form antibodies against the antigens. We've talked about the antigens in morphology section. Antigens are group-specific antigens, that are specific to all treponemas, species-specific antigens that are specific to Treponema pallidum, and cardiolipin. These are found in spirochetes and cells in our bodies. Immune cells also form granulomatous lesions that is called gamma, that is the chorionic granuloma, which is surrounded by various immune cells and fibroblasts. So the tissue inside does not get oxygen and dies, which results in coagulative necrosis. Tertiary syphilis also involves organ damage. If it damages heart and blood vessels, it will be cardiovascular syphilis. If brain and spinal cord are involved, this is neurosyphilis. Liver, joints, and testes are also affected. Tertiary syphilis also affects the eye, causing Auger-Robertson pupil. Let's talk about the cardiovascular syphilis. It causes endarteritis, that is the inflammation in the small capillaries called vasa vasorum that supply the large artery called aorta. An inflammation of aorta will lead to aortitis and aortic aneurysms. If you look at neurosyphilis, if it affects posterior spinal cord and the capillaries supplying the posterior spinal cord has these spirochetes in it, that will lead to tabes dorsalis, that is the wasting or loss of back of spinal cord. This will lead to loss of vibration sense and loss of proprioception. If it affects the anterior spinal cords, mean capillaries supplying the anterior spinal cord contains these spirochetes. This will lead to general paresis. That involves the loss of sensation, weakness, and paralysis, often in the legs. If these spirochetes are found in the capillaries supplying the brain, it will cause slurred speech, altered behavior, memory loss, difficulty coordinating muscle movements, and paralysis. If the Treponema pallidum damaged the eye, it will be causing Auger-Robertson pupil, which means that pupil loses its light reflex. That means that it doesn't constrict when there's too much light, but it does have its accommodation reflex. Now let's talk about the second type of syphilis, that is congenital syphilis. That results from transplacental transmission, either in uterus during gestation or while birth through vagina. Congenital syphilis also has two stages. Either the baby will be stillborn or will be dead in the womb. There will be maculopapular rash on palms and soles. There will be optic neuritis if it affects the eyes of the baby. There will be snuffles. Snuffle means that nose is blocked by the increased secretions, which contain lot of spirochetes. There will be organ damage to liver and spleen, causing hepatosplenomegaly. Late stage that occurs after 2 years of the birth, which includes saddle nose, that is bony destruction of the nose. Sebaceans, which mean the tibia bone will be bent. Hutchinson's teeth, which mean teeth develop notches. Mulberry molars, frontal bossing, ragads. There will be hearing loss.